Good afternoon, good afternoon, good afternoon. Welcome to today's webinar. We're so happy, glad that you're able to join us on today. I'm Michael Miner. I am the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry, and I will be your host for today's webinar. Look, we want to begin by asking each of you to do what I've already done. Why don't you go ahead and share? Go ahead and share today's webinar from your social media page. Now, look, you can go to Facebook. So if you're doing it right now like I'm doing, you can just pause. You can go to to our National Baptist Facebook page. And with the National Baptist Facebook page, National Baptist Convention Hope Facebook page. And once you get there, you can click on that video. All right. And once you click on that video, you can go down there and click on share, and you can share it in your network. See, there you go. You can hear me in the background. So do that. Share it to a couple of your friends, share it public, share it to some of your groups, other websites. I want you to do that now. All right. If you're on texting, you can go to our YouTube page, our National Baptist Convention USA Incorporated Hope YouTube page. You can copy the link and you can share it with others. All right, we want you to share this wonderful information that we're going to have today. I do want to begin by acknowledging our national leadership team for the National Baptist Convention USA Incorporated. Dr. Jerry Young, our president, Dr. Alvin Edwards, our general secretary, Dr. Alvin Love, the chair of the Federal Faith-Based Development Initiative, yours truly, Michael Miner, the national director, the NBCUSA liaison to the U.S. Department of Health and Human Services. All right. And I also want to acknowledge my tech assistant today, Brother Thomas Duke Robinson. All right. Today's webinar, we'll have a conversation about the Affordable Care Act, Obamacare, the 2022 open enrollment period. Today's webinar is a collaboration of the NBCUSA H.O.P.E Health Initiative and Get Covered Mississippi. In congregations and communities across the country, we'll be working this Faith Week of Action and doing this season of giving to encourage you and your loved ones to review your health coverage options and enroll in coverage that best meets your needs. We do, before we get started, want to remind everyone to be sure and take your COVID-19 vaccine. If you're not taking the vaccination, all right, your initial one or the booster, we encourage you to do your best. I took mine, and I took the booster, and I'm doing fine. If you've taken your booster shot, would you encourage those in your network, those close to you, to do the same? We thank you in advance. God bless. All right, let's begin our webinar today with an overview of our two collaborators, the National Baptist Convention USA Incorporated Hope Health Initiative and Get Covered Mississippi. Well, what about Hope? The National Baptist Convention USA Incorporated Hope Health and Wellness Initiative is a collaborative effort of National Baptist churches, medical professionals, and health-related organizations committed to health, H, outreach, O, and prevention, P, education, E, Hope. The NBCUSA H.O.P.E HHS partnership serves as the NBCUSA's liaison to the U.S. Department of Health and Human Services. All right, Get Covered Mississippi. All right, what is it about Get Covered Mississippi? Well, Get Covered Mississippi is a statewide faith-based coalition focused on raising public awareness and engaging consumers about health coverage options available through the Affordable Care Act, ACA, Medicaid, CHIP, Medicare, and federally qualified community health centers, and promoting the importance of health and wellness and promoting the importance of healthy living choices. Get Covered Mississippi was birthed from the community health and wellness outreach efforts of the Hill Hernando Baptist Church and Mid-South Church Cooperative Conference Baptist State Convention. I am the executive director of Get Covered Mississippi, but I'm also even more proud of the fact that I have been a navigator since the program began in 2013. 8 years as a navigator serving the people here in the state of Mississippi. This is a national call today. We'll be sharing information of a general nature. As we see those things are differentiate across the country, we will let you know. But I chose to host this session based upon my experience in sharing on today. Again, we encourage you to share. And look, I'm just overjoyed. I'm looking now at our analytics, and we have so many of you all who, in the middle of the day, have just paused and taken time to watch us on social media. Remind you, feel free to share it in your Facebook family, in your Facebook circle. And we also remind you, if you have some others who are working today, this video will be up on our Facebook page. You can share it later, and also on YouTube. Again, even before we get started, just thank you from the bottom of our hearts for taking time out to watch today's webinar. We know a lot of you have gotten Zoom fatigue, Facebook Live fatigue, and you're here today. So thank you. All right, let's talk about the ACA 101. What is the Affordable Care Act? All right, let's watch this short video to learn 5 things about the Affordable Care Act. 5 things to share about the Affordable Care Act. Obviously, there's a lot more, but here are 5 things.
Signed into law in March 2010, the Affordable Care Act benefits all Americans, increasing access to quality, affordable health insurance and providing rights and protections that make health coverage more fair and easy to understand. The increased access to insurance options helps narrow geographic, economic, and racial disparities in healthcare coverage. Here are 5 things to know about the Affordable Care Act, also known as the ACA. First, the ACA produced widespread gains in health coverage. Over 20 million people gained insurance, including individuals who can stay on their parents' plan until they're 26. Second, the Affordable Care Act protects Americans with pre-existing conditions like cancer, asthma, or diabetes. Insurance companies can't deny coverage based on a person's medical history or health status. The law also prevents insurers from setting annual or lifetime limits on spending. Third, the ACA focuses on preventive care. It ensures that most insurance plans fully cover the cost for certain recommended preventive services. Colonoscopies, mammograms, well child visits, and flu shots, for example, are provided at no cost to the patient thanks to the ACA. Fourth, the ACA improves health care for women and children. The law prevents insurers from charging women higher premiums than men and requires insurers to cover maternity care, breastfeeding support, birth control, and other services critical to the health of women and children. It expanded to include millions of low-income individuals and families who did not previously qualify for coverage. Fifth, the Affordable Care Act is better than ever. Cover options are increasing and costs are decreasing. President-backed economic stimulus, the American Rescue Plan, ensures that people who enroll in health coverage through healthcare.gov will qualify to save plans on average by $50 per person per month and $85 per policy per month. 45 customers will be able to find a plan for $10 or less. For more information or to sign up for affordable coverage, visit healthcare.gov.
All right.
Produced by the U.S. Department of Health and Human Services.
Look, we apologize for, we're dealing on a live broadcast and on our Wi-Fi capabilities, but we hope you got the end of that video that talked about the new benefits that are available through the American Rescue Plan that was proposed and passed through Congress by the Biden administration. And look, let me just say this before we go any further. It is just wonderful through the Affordable Care Act that we have this Medicaid expansion and available in many states, not all states, but in many states. The preventive services are covered. And for somebody like me that has a pre-existing condition, there's no pre-existing condition exception. You get coverage, but if you got a pre-existing condition, it's a problem. But I do want to say this. look, some of you all have gone to health, and look, we're going through the rest of our session, but some of you all have gone to healthcare.gov or you called in, and the premiums you felt just were not affordable, and you just gave up, threw your hands up in there. Let me tell you, under the Biden administration's American Rescue Plans, with this new adjustments on the advanced premium tax credit, the subsidies, you'll be amazed at how affordable the coverage is. If you have not gone to healthcare.gov recently, look, you should go today and you should look and see what your options are. Look, you have nothing to lose and everything to gain. Let me go on, but I want to remind you, if you haven't been to healthcare.gov lately and checked it out, you need to do so today. All right. Now, so the reason that this American Rescue Plan made it so affordable is that it increased the amount of the advanced premium tax credit and also changed some guidelines for income. All right. In fact, 4 out of 5 consumers can find health insurance for, check this out, $10 or less per month through healthcare.gov. Now, let's focus on enrollment, open enrollment for 2022. That's coverage starting in January of 2022, or if you enroll a little bit later, February 2022. All right, here are 5 things to know about this year's marketplace open enrollment. All right, first of all, the key dates. Open enrollment already started. It started November 1st, and it's going to run through January 15th of 2022. Now, listen to me carefully, y'all. Listen, listen, listen. Okay. All right. If you enroll by December 15th, that's like next week. If you enroll by December 15th, if you successfully enroll by December 15th, your coverage is able to start as soon as January 1st, 2022. Let me say it again. If you successfully enroll by December 15th, next week, your coverage can begin as soon as January 1st, 2022. All right. Well, if you miss December 15th and you get back there a little bit later, then you can enroll by January 15th. All right. Now, obviously, if you enroll by January 15th, your coverage won't start January 1st. Your coverage will start as soon as February 1st, 2022. All right. So let me go through it again. If you enroll by December 15th, your coverage can begin as soon as January 1st. If you enroll by January 15th, it can begin as soon as February 1st. So you know what? Why don't you not even think about what those deadlines are? And if you have not enrolled, you've been thinking about it, why don't you go to healthcare.gov, healthcare.gov right now, don't delay, and go ahead and enroll. All right. Now, if your state has a state-based marketplace, your dates may be different. If it's a state-based marketplace, your dates may be different. And you'll know, you can go to healthcare.gov, you put in your zip code, and they can direct you on where to go. We will base today's webinar on the general healthcare.gov, the federal marketplace. More affordable, more affordable, more affordable. I'm going to say it again, more affordable. The American Rescue Plan, the Biden administration, has provided greatly improved financial assistance, which can significantly lower people's premiums. If you looked for health coverage before and you were not happy with the premiums, it is worth a second look. Again, 4 out of 5 people will have plans, 4 plans that are $10 a month or less. And it's because of newly expanded financial assistance. And with the new law, millions more people qualify for tax incentives that lower their premiums. Even people before who didn't even think about qualifying for an advanced premium tax credit are now able to qualify. Now, some people have questioned this about the quality of the plans. So, what kind of plan am I going to get through the ACA? Well, let me share with you this. This is a federal exchange. In other words, the federal government or the state, depending on where you are, they have facilitated a space where there's private insurers that offer plans, and consumers can go into this space, fill out information, see what they qualify for advanced premium tax credit, and select a plan from a private insurer. This is not a federal insurance program like Medicare. It is, in fact, you are purchasing insurance from private insurers through a federally facilitated marketplace. We know a lot of people say, I don't want government insurance. Well, it's not government insurance. It is private insurance through a federally facilitated marketplace. We want to make sure you knew that. So they're quality plans. They are coverage. All kinds of other plans we'll talk about in a minute don't have the kind of coverage, but it's got doctor visits, emergency care, all other kind of things that you want to think about. I want to focus in on the mental health components, behavioral health. We don't talk about enough, but it is covered as a part of the Affordable Care Act. Hospital care, prescription drugs. It is quality coverage, quality coverage. And look, I see that we have some questions already coming up on social media. We're going to get to those. We're going to answer many questions that we have. We're going to get through our presentation first, and then we'll be able to answer your questions. So thank you already for those who are watching on social media. All right. Now, more help is available. Okay. And what we mean, if you want assistance in completing your application, okay, we have navigators, which I am one. We have certified application counselors in every state and county in the marketplace, their coverage. So the certified application counselors, navigators are paid for by the federal government. And the deal is we can provide unbiased, amen. Look, since we're on a faith-based thing, can I put that amen in there? We can provide unbiased education and enrollment assistance for you in this faith week of action. Yes, if you need assistance, you can go to healthcare.gov and go to local help, healthcare.gov, local help. And when you go there, you can find the information that will assist about a local assister near you. I keep saying healthcare.gov over and over again, don't I? There's a lot of great information there, but there's some people there that can help you, they can assist you in getting covered. And it is easier than ever for coverage this year. You can go to healthcare.gov right now, or if you wake up in the middle of the night and you said, I want to enroll, it is there 24 hours a day, 7 days a week for you to get information. Okay. All right. Now, let me just say one thing about this. Now, I know today is December 7th, not only, and look, we do pay our respects to those who are, today is Pearl Harbor Day and December 7th. So for those, especially, we want to give honor to all those Pearl Harbor survivors who are still alive. But it's also the deadline for Medicare open enrollment. Now, Medicare is not a part of the ACA open enrollment. It's not. No, Medicare is not part of the ACA open enrollment. So I want to make sure that we all understand that, okay? It is not part of the open enrollment. All right. So I would say, look, you may have questions. You should have already taken care of that. But if you're one of those last minute procrastinators and you want information about Medicare open enrollment, then you should go to medicare.gov and find assistance there. But you know something, you all? It makes me think about, okay, what are the different ways that people in America can obtain health insurance? I just something to think about. You know, we go through this, we talk about it, we talk about the Affordable Care Act. But I think one of the important things that we can do now is pause during this webinar and give you an idea in this nation where people get their insurance. Okay, let me see. I'm going to share my screen. That's okay with you. All right, here we go. All right, here we go. Okay. Now, if you look at this slide, okay, health coverage in America. Obviously, most people get coverage through their employer. All right, about half. Then the next three programs are federal and state programs. Medicare for those people 65 and older, or people with disabilities, end-stage renal disease, other issues on the Medicare. Medicaid is the federal state program. And Medicaid expansion is part of the ACA. This Medicaid CHIP part is for children up to age 19. So if you look at it and add those numbers up, about, let's say 22, 32, 30, about 40% of Americans are covered through one of those federal programs. And then we have at about 9%, the Affordable Care Act, okay? I mean, about 3%, 9 million folks. This is from 2016. There are more people now. This number has changed. This is the most recent numbers that we have, and we have more than doubled that number during the Biden administration. But I wanted you to see the relative numbers of people in each one of these categories. The number that really bothers me is the number of uninsured people. We need to lower that number. So as we can see, that it's probably what you thought about, what you figured it was for coverage. But I want to throw something else out at you all. A lot of the people who have coverage through the Affordable Care Act, a number of them are self-employed. Yes, self-employed. And in America, self-employed folks are the job creators. Because even though you a place like one of the Fortune 100 companies may have millions of workers, but there are millions of sole proprietors out there, and they are doing great work. And one of the things that we heard so many times, I remember in 2013 and 14, when we started open enrollment, is that they were starting. Matter of fact, let me tell you a story. It was this couple. The wife was the bookkeeper, and the husband was a consultant at the time, making over $100,000 a year and was growing. But he also had to work a part-time job because they needed health insurance. When the ACA came out, they were ecstatic, because what that meant is that he could quit his part-time job. Okay, they could have coverage, and he could devote more to the business. From my understanding, the business has grown now, is incorporated, and hired more folks. But the key thing is, if he were not able to get coverage through the ACA, who knows where he would have been in his self-employment journey. Okay. Look, I don't want to do all the talk today. I do want to share a little bit. And again, the questions, we remind everybody on social media that we are going to get to your questions. Just hold tight. We're going to have a Q&A. We are tracking your questions on social media. And as we're almost about halfway through today's webinar, we want to remind each one of you all that this is the National Baptist Convention USA Incorporated and Get Covered Mississippi ACA Faith Week of Action webinar. I'm Michael Miner. I am the moderator for your call today. We're glad that you were able to join us. We are also sharing this on Facebook and YouTube. Feel free to share it in your networks. Okay. All right. We're going to come back some real stories and real coverage. There you go. I'm going to bring it up. And so we can watch this video about real stories about the ACA.
I was surprised how I accepted not having for so long.
This is the first time I've had health insurance.
If not for the Affordable Care Act, yes, I would still be uninsured.
It was impossible to get good insurance on the open market because of our pre-existing conditions.
I was impressed that I had a lot of options on all the different kinds of tans, the bronze, the silver, the gold, the platinum, I think it is.
I was able to view a screen with 76 health insurance plans. You can register for Facebook, Twitter, Instagram, Pinterest, then you can definitely sign up for the marketplace.
Before the marketplace, we were gonna pay probably 3 times what we pay now.
For me, it just came down to pure math, pure dollars and cents.
For my health insurance, I pay $65.
$21.
$15 a month. So it's pretty awesome.
I have so much peace of mind just having health insurance.
The Affordable Care Act has allowed me to literally pursue my dreams.
For me, it means that I can do both, pay my rent and go to the doctor when need be.
So I'm alive today because of access to healthcare. I am cancer-free because of the marketplace.
All right, look, let me just stop that video on where we are. Okay, and wasn't it wonderful for the gentleman to say that he is cancer-free? He's cancer-free because of coverage through the Affordable Care Act. We're gonna show another video shortly, but we've been hearing stories like that, you all, since 2013 from all across our work here in the state of Mississippi. The number of people have chronic conditions and they were concerned about how they're going to get their insulin, how they're going to manage their high blood pressure. And with the Affordable Care Act, they would have able to have coverage they were able to afford. They were able to see a health professional. And not only have they extended their quantity of life, but they've also extended their quality of life. This is one of the untold stories of the impact of the Affordable Care Act. Just the thousands of people who have benefited, again, from the quality and quantity of life. Look, we do have another section that we want to be able to show. Hold on, we'll share our screen again so we can see some more things from some real people.
My name
Real
is
story.
Jennifer. I live in Virginia as a self-employed tutor. Healthcare not having security for me, financial security. I've taught at 5 as a sole proprietor, and it really does come down to me. If I'm not in my chair tutoring, I am losing money. Okay, perfect. If you don't have healthcare, then you are pretty much one medical emergency away from bankruptcy at all times. And that's, for me, why it's important to use my healthcare for preventative measures, going in for annual checkups, well-woman visits, and things like that. If you go to healthcare.gov, you're going to be able to find, because there's a lot of providers and there's a lot of options. My rate actually has gone down significantly, and I can also every year choose a plan that works for me. Healthcare.gov is peace of mind. Hey Sandra, how are you? Because now I know that no matter what, I can find an affordable plan where I can go to the doctor, take preventative measures, and live my life.
New law, lower prices, more people qualify. Enroll by December 15th to get coverage starting January 1st, 2022. Healthcare.gov.
All right, so that is another one. Again, we see the emphasis on the self-employed. A lot of the gig workers, it's also our gig worker emphasis week as well. A lot of people. Didn't you hear what she said? She said, if she is not there in front of her computer working with her clients, then she's not making money. So because of the ACA and the preventive care services that are available, she's able to do her job. Beautiful, simply beautiful. All right, we're going to have one more story. Okay, here we are. And again, we apologize. We on our tech assistant had Wi-Fi issues. So we're going to go and do it this way. Here we go.
If you weren't covered by healthcare.gov, we are potentially one injury away from possibly losing our business.
I'm Scarlett. I'm a personal trainer and wellness coach.
I'm Tyrone. I'm a personal trainer and wellness coach. We live in Pennsylvania.
I know that we both get so much joy out of bringing wellness and making people feel whole and happy.
I think the recent pandemic we've had has shown that we as average Americans, no matter what age, need healthcare. Having our own business, we didn't have anybody to give us those policies, give us that insurance. When I was looking on healthcare.gov, I did find a plan that was affordable and has gone down over the last year.
It covered all the bases that we need. We have our eye, our dental, and your primary care. And it's great because having a young child, you have wellness checkups all the time. The fact that we own our own business, we have health insurance. It's two major checkpoints in life.
Healthcare.gov will allow you to find a policy to help you chase your dreams and have a peace of mind while you work.
New law, lower prices, more people qualify. Enroll by December 15th to get coverage starting January 1st, 2022. Healthcare.gov.
All right. Wow. Again, we can continue to see that ongoing story about those that are self-employed, that are given an opportunity for coverage. You can also, for those that are watching across the country in our churches that want to share these during your hybrid worship experience or your virtual worship experience, just email us at info@hopenbc.com and we can share the links with you. Or you can go to the healthcare.gov YouTube page and show these some powerful stories of real people who benefited from the Affordable Care Act, especially the American Rescue Plan from the Biden administration. Look, y'all, access to health coverage is a human right and is essential to ensuring dignity for all people. Thanks to the Affordable Care Act, millions of Americans have been able to enroll in affordable, quality health coverage. We know there are many more Americans across the country that need health coverage, and the pandemic has highlighted how important it is for everyone to have health coverage. Whether you are uninsured, do not receive health coverage through your employer, or you're looking for more affordable health care coverage, you are eligible for health coverage on the health insurance marketplace. All health plans on the marketplace must cover a comprehensive set of benefits, including physician visits, preventive care, hospital stays, and prescriptions. Plans must also treat everyone fairly. All plans on the marketplace cover treatment for pre-existing medical conditions. Look, none of the insurance plans on the marketplace can reject you, charge you more, or refuse to pay for essential health benefits for any conditions you've had before your coverage began. Wow, that's wonderful. Use this giving season to remind your loved ones and friends of how important it is to have health coverage. Look, when you are around the, as I say, can we be a country? When you're around the supper table, the dinner table there for Christmas, that's a good conversation to have about your health coverage. All right. We do want to just say something about the signs we may have seen across the country that talk about Obamacare plans. Matter of fact, one of our Mississippi navigators called one of the numbers listed. You know, she was just inquisitive. And it was clear that the salesperson was selling something totally different from the ACA. So we wanted to just take a moment, I'll share my screen again, to show you some differences between what we maybe call these skinny plans or short-term plans that some people try to market as the Affordable Care Act. So now you need to make sure that when this coverage, and you may go across some websites that look similar to healthcare.gov, but are not necessarily healthcare.gov. Maybe some phone numbers that looks nearly the same. And there may be some people who will try to act like that they are a navigator or a certified application counselor. All right, but these are 6 things to look for to make sure that you have a qualified plan through the Affordable Care Act. All right, about pre-existing conditions. On many short-term plans, which are not sold on healthcare.gov, you may be denied coverage for a pre-existing condition. Okay, and by the same token, you may be charged more. On the marketplace, you cannot be denied for a pre-existing condition, and you cannot be charged more for a pre-existing condition. It's a marketplace. What's covered? Those 10 essential benefits, the doctor's visits, the preventive care before reaching the deductible, prescription drugs, maternity care, all those things. They are covered in that bundle under the ACA, not necessarily on the short-term plans. Okay. So if you have a health condition, including being a woman and of childbearing age, okay, then you are covered for those conditions. But as a short-term plan, you may or may not. Okay. And then are any lifetime limits on what the insurance company will pay on the marketplace plan sold through on healthcare.gov or through your state marketplace? No. But short-term plans, yes. And of course, the biggest thing right now, considering the Biden administration's American Rescue Plan, you can get, you may qualify for assistance to lower your premiums or your out-of-pocket costs. That is available. That is not available through your short-term plans. So when you see these signs that say Obamacare coverage, make sure you keep this in mind. You got family or friends that are looking to have coverage. Make sure they look at all the fine print and they understand what the difference is between those qualified plans through the ACA and those short-term plans. Okay. All right. Again, December 15th will be here before you know it. That's next week. We encourage everyone listening. All right. If you already got coverage, great. But if you know someone, to tell them to go and enroll by December 15th so that coverage can start January 1st. It can start on New Year's Day. You can celebrate the New Year's with new coverage. Start the new year off right. All right. Now, we've covered a lot of information today, and we hope you've been enlightened about what we've shared. Okay. We also applaud the Biden administration for its bold efforts to expand marketing and enrollment opportunities in ACA. All right. Thank them so much. And thanks again for that American Rescue Plan. We thanks again for everyone that's participating. We're going to get ready for our Q&A part of our discussion today, but we do remind you may find more information about us at hopenbc.com. We do have some upcoming events. Our training for Health Ambassador training, we're working on our new schedule that'll be coming out the first of the year. We also have another webinar this week. It'll be Thursday night at 6 p.m. Central, 7 p.m. Eastern. We'll provide a preview of our 2020 Hope Suggested Health and Wellness Observances. And our moderator will be our very own Dr. Felisa Washington of Alabama, our NBCUSA H.O.P.E digital coordinator. If you want more information about that before then, you can go to info@hopenbc.com for more information. That is going to be on Thursday night at 6 p.m. Central, 7 p.m. Eastern. All right, now, okay, I know all you all, wow. We're not going to get to all these questions today. We're going to keep this to an hour. So we're going to do our best that we can for our questions. Okay, all right, Brother Clarence. All right, you have a question or comment there, Brother Clarence?
I've got a question and a comment, Dr. Miner.
Yes.
My comment is, you mentioned several times, enroll by December 15th, and you'll be eligible for coverage on January 1st. But enrollment is not complete until that first month's premium is paid. And that just want to emphasize the fact that if they don't get their money, you don't get your coverage until that first month's premium is paid. Sometimes when we're enrolling as a navigator, it's going to be left up to the enrollee to determine how they're going to make that payment. If we have a person that's going to healthcare.gov and signing up on their own, then the program takes them right to where they can pay their first month's premium at that time. So again, enrollment's not complete until that first month's premium is paid.
All right, y'all heard that. So pay your premium. Thank you there, Brother Clarence Campbell. He's also a navigator in the state of Mississippi, and he's a good National Baptist too. Thank you, Brother Clarence. Okay. All right, let's start working on these questions, okay? All right, the first question we have, how long after I enroll in the plan will coverage take effect? Well, you know, we kind of talked about this, and Brother Clarence emphasized this again. So during open enrollment of healthcare in some other states, if you enroll, pay your premium and everything, if you enroll by December 15th and pay your premium, then your coverage can begin as soon as January 1st. If you miss that December 15th and enroll by January 15th, your coverage can begin as soon as February 15th. Now, if you, coverage can about February 1st, excuse me. And if you are in a state-run marketplace, make sure when you go to healthcare.gov, put in your zip code, and they will give you the specifics for your state. Okay. Woo! This next question is something here. Listen up. All right. I just moved from one state to another. I don't have a permanent home yet. I'm staying with a friend until I find a job and get settled, but I need health insurance right away. How can I establish document residency in my new state? Wow. Well, the fact that you don't have a permanent home, because, you know, people that are homeless can get coverage through the ACA. All right. So the thing is if you are residing there and intend to remain there, you can go to healthcare.gov. Okay. So you have to document your move, showing your former address, such as a lease, a voter registration card, things like that. And for your new address, you can do a signed statement to the marketplace, stating that you're living with a friend and you're not just living there visiting temporarily. Your friend will also have to submit documents such as those described that we talked about before to prove that they're a residency, lease, so on and so forth. Okay. You may also qualify for a special enrollment period, which is 60 days. We didn't talk about that in this webinar, but it can give you time beyond the open enrollment period, possibly, to make sure that you are covered. Okay, so that's what you'll have to do. Look, if you go to healthcare.gov, there's more details. Call, or a navigator or a certified application counsel will be able to help you. All right, this is a good one. I'm leaving my job and will be eligible for Cobra. Can I shop for coverage and subsidies on the marketplace instead? Yes, you can. Leaving your job and losing eligibility for job-related coverage, well, in addition to being an open enrollment period, it'll trigger also a special enrollment period that lasts 60 days. Only reason I bring that up, when the open enrollment ended on December 15th, it allowed people time beyond the open enrollment period. So you can work with both of those, the 2022 open enrollment period or the SEP, whichever one is longer if needed. And you can go through the marketplace. You can put in your information and make sure for the coverage that you desire. Now keep this in mind that if you do enroll in Cobra coverage through your former employer, you will need to wait to the next marketplace open enrollment period if you want to switch to a marketplace plan. So if you got the choice, then you can go ahead and make a determination of whether you will go through Cobra or marketplace. But if you're already enrolled in Cobra, you have to wait until the next open enrollment period. Okay. All right. I live in one state, but drive across the border every day to work in a different state. What marketplace should I use to buy coverage? Easy answer. You get the coverage for the state you reside in, not the one you work in, the one you reside in. Okay. Another good question: can I get help with my marketplace application? Yes. All state marketplaces and the federal marketplace are required to offer navigator programs to help consumers complete their applications for financial help, including help applying for Medicaid or CHIP. Navigators like myself are also help people review plans and appeal marketplace decisions. Navigators are not paid by insurance companies. They're paid by the marketplace, okay? And they complete, we go through training, marketplace training, and we don't have any conflicts of interest. In other words, we don't work for the insurance companies, getting something back from the insurance company from the people that we refer to them. We are unbiased in our efforts to assist consumers, okay? You can go to healthcare.gov and go to local help, and you'll find this information there. And you go to local help, there's two kinds. Again, the navigators and the certified application counselors. Okay. And then also the insurance brokers. Now keep in mind the insurance brokers on the marketplace website, they work for insurance companies. They are paid commission by the insurance company. And naturally, they're going to be representing the company in which they are being paid on their commissions. All right. Navigators, certified applications, unbiased, okay, independent, don't work for the insurance company, not getting any commission. The brokers are going to be particularly most time for a particular company, and they'll be trying to push their particular insurance plans. Okay. All right. Oh, this is a great question, y'all. This next one. What does it mean to use tobacco? I'm pretty sure my teenager has smoked at least a couple of times. Do I have to pay a higher rate because of her? Awesome, girl. Well, tobacco use means a person that used tobacco product an average of 4 or more times a week for the past 6 months. Now, a state can increase the number of times per week or reduce the look back period to less than 6 months. It's on the state-based exchanges. So check with them about what the coverage is. But the surcharge only applies to individuals who are legally able to purchase tobacco products. Okay. And right now, the surcharge does not apply to anybody under the age of 18. Okay. All right. So, okay, we have a Medicare question. If I have a marketplace plan and then become eligible for Medicare, will my marketplace plan be canceled automatically when my Medicare coverage starts? No, your marketplace plan will not be canceled automatically when your Medicare coverage starts. You must contact your marketplace insurer directly to cancel your marketplace policy. Okay. Now you can keep your marketplace plan until your Medicare coverage starts. Matter of fact, if you like, you can keep your marketplace plan too. But once your marketplace, your Medicare Part A coverage starts, you'll no longer be eligible for any premium tax credits or other cost savings. And you may be getting on your marketplace plan. You have to pay full price for it. Okay. All right. All right. So look, we're getting close to the wrap up time. So let me just get this one more question here. I'm a young adult and I need health insurance. What are my coverage options? Well, a number of options may be available to you. Okay. Obviously, if you're under the age of 26, you can stay on your parents' coverage. If you're going to college, maybe it's coverage through the college health services. If you're older than 26, you can go onto the marketplace and look for coverage. And depending on your income, you may qualify for some assistance there in obtaining the coverage. Wow, I think I probably could keep on answering questions about another half hour. What we're going to do, we got some email addresses, and we'll work to provide answers to all the remaining questions via email and the social media chat. Wow. Woohoo. We have just been just thrilled at the number of people across all our social media platforms who took the time out today to watch it. We'll make sure to go through and give you answers to the question you have. We'll do that on the next few days. You can, again, you can email us at info@hopenbc.com. For those that are watching on Zoom and those that are on social media, we'll make sure to post out our link for our survey so that you can tell us how we're doing. The biggest room there is the room for improvement. All right. Let's not forget National Baptist, our December marketing updates. This is National Drunk and Drug Driving 3D Prevention Month, where we encourage safe and sober driving during this holiday season. All right. This week is National Influenza Vaccination Week, Flu Shot Week, where we're focused on highlighting the importance of your flu vaccine. All right. You can join us on the web and social media. Our web address is hopenbc.com. Go to our Facebook page, National Baptist Convention USA Incorporated, Hope Health Initiative. We're on Twitter at Hope_NBCUSA and our YouTube channel, NBCUSA Hope. look, we're working. So the first year, we've gotten so many great videos there. We're organizing now with different playlists. So we're hoping that you'll be able to get even more benefit from our YouTube page. Okay. Again, don't forget to respond to our survey and provide us feedback. Okay. All right. We appreciate everyone. We appreciate the tireless work of all of our team members. I call the team National Baptist Convention USA Incorporated Hope Health Ministry. We appreciate each one of them for the work they do. Right now, I've been working a whole lot on our newest initiative through the National Institutes of Health. It's called the All of Us Research Program, where we're doing our best to enroll 1 million or more people in this health study to learn more about what makes us healthy, what makes us tick, what makes us well. All right. So if you want to learn more information about that, you can go to joinallofus.org/NBCUSA. You can go to, again, right behind me here, you can go to joinallofus.org/NBCUSA and learn more about this effort from the National Baptist Convention USA Incorporated and National Institutes of Health. Be one in a million. joinallofus.org/NBCUSA. Once you do it today, find out more information, and you may find that you want to go ahead and enroll. We also want to, again, thank the collaborative effort of Oak Hill Regional Community Development Corporation, which is the grantee for Get Covered Mississippi. That's the website, getcoveredms.org, and also for Medicaid and CHIP assistance, Healthy Kids Mississippi, healthykidsms.org. So I collaborated today, Get Covered Mississippi, Oak Hill Regional Community Development Corporation. Thank you so much for the collaborative spirit we had today. So that for those that live in the state of Mississippi, you can contact them today at 662-298-3584. In the state of Mississippi, 662-298-3584 for assistance. All right, we're wrapping it up here. We appreciate our team. Dr. Desi Levy, Lottie Minor, I might know something about her, Bettina Campbell, Pastor Dexter Moraney, Ellen McKnight, Dr. Felisa Washington, Minister Geraldine Moore, Loretta Miller, Dr. Lavora Williams, Nettie Johnson, Dr. Marion Talley, Thomas Duke Robinson. We also give a shout out to our 7 regional coordinators, Pastor Daniel Blackburn in the Northeast, Brooklyn Rogers in the Southeast, Pastor Bernard Montgomery, Southwest 1, Linda Copper, Southwest 2, Teresa Fales Farr in the Midwest, Norma Jackson in the West, and Pastor Richmond Johnson in the Far West. For those that are watching on Zoom, after we end the social media broadcast, we'll hang out for a few minutes to field in additional questions or comments. But once again, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless and keep you is our prayer.